Good morning. My name's Bob. I work part-time as a paediatric oncologist up the road in Leeds Children's Hospital and part-time at the University of York, where I do some researchy things. And what I want to talk today about and with you about is uncertainty. Not quite sure what I'm going to say. What words do you know or use that are about uncertainty? Unsure?
Doubt. Maybe.
Hypothetical. Unknown. Worry.
Question. Fear. Scared.
I think was the contribution from the pram. Different words about uncertainty. So, words of emotion. Words about how uncertainty makes us feel. Words about uncertainty, unsureness, not knowingness. Different ways of thinking about it. We all live in a world that has lots of sorts of unsures and uncertains in it, and what I want to do is to think about some of the different types of uncertainty, in a sense, of thinking about how unsureness might be thought about in different ways. And there are some words that sort of capture broad areas of why we might be unsure or what sort of uncertainties are out here. And some of them may be uncertain because we can't see closely enough. It might be that if you sat at the back in 2 presentations' time, you're not quite sure what it says on the slide because your eyesight and the distance don't match. So there might be that sort of uncertainty. There might be uncertainty because things are constantly changing. It might be that things are just very complicated, and so we're unsure because something's so complicated, we don't know what's going to be happening. And it might be unsure because things are vague. And so I want to explore some of these ideas, starting with a hat. This is a hat. These are some sweeties. Sweeties? Hat. Sweeties hat. Now, if you can put all the sweeties in the hat.
Right.
Okay, this is the black hat. It has in it 8 yellow sweeties, 8 amber sweeties. Is anybody allergic to sweeties? Good. Before the hand comes out of the hat, what colour is the sweetie going to be? Amber. Amber. It's going to be amber? It's going to be amber? How much chance is there of being an amber sweetie? There's 8 yellow, 50%. Yeah? What colour is it?
Amber.
It's amber! The sweetie's out of the hat. If you give a sweetie to a dietitian, you can be certain it won't get eaten, you see. So it's safety. Safety. What colour is the sweetie inside the dietitian's mouth? Is it going to be yellow or is it going to be amber?
Yellow.
Yellow. Why yellow?
More yellows than ambers.
Because there's more, so the chance it's slightly going that way. So we've got uncertainties that we would be able to calculate as we went through. We'd start off with 50%. As one colour came out, it would fall one way. As one colour came out, it would fall another way. Because we've got a fixed number in here. An uncertainty that we could calculate. And when we talk about uncertainties that we can calculate, we can talk about our estimates, our guesses of what's going on, being within a certain degree of accuracy. And by that, we know that the more we do something, the more we study something, the more chance we have of knowing, on average, what's going to happen. And the more numbers that we have in our pot of study to see what's happening, the closer we can get our guess. And so our uncertainty can get smaller and smaller the more numbers that we put into it. And if we have something that works very well and tells us the truth that's out there, then it's very, very precise. And we can become increasingly precise when we get better technologies to spot things and more numbers, and we close down our mathematical uncertainties because we reduce the elements of chance and we get tighter and tighter in knowing what it is that we're talking about. So sometimes when we talk about being uncertain about things, it's because we have too small numbers to really know where the truth is, and we have a wide guesswork window that we're working with. That's one sort of unsureness. Now, I have in this bag some pink brains. They are not real brains, don't worry. Brain? Is that a heap of brains? You can speak, it's okay. No. Is that a heap of brains? 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 Yeah, that's a heap of brains. Is that a heap of brains? Is that a heap of brains? Is that a heap of brain? Where does it go if you've got a pile of grains of sand? Where does it go from being not a heap of sand into being a heap of sand? Is it at 1,000 grains? In which case, at 999 grains, why is that not a heap? If it's at 1,001 grains, why is 1,000 not a heap? Why is 1,001 a heap? What is it that takes us across that barrier? And it will be different for different people. I think this is a heap of brains. That's great. I like that. Sometimes there's just ambiguity out there. That looks like a heap of sand to me. Take a grain off, it'll still look like a heap of sand. Take 200 grains off, will it still? At what point does it cross from being not a heap of sand into being a heap of sand? Where is that grey area? And what we do a lot of is make decisions. So, some of you will know children, or have children that have had leukemia or have leukemia. In leukemia, when you first present with acute lymphoblastic leukemia, one of the subtypes, there is a decision made partly on the basis of how high the white cell count is as you come into the highest point before you start treatment, as to whether this is classed as high risk or low risk leukemia, group A, group B. It's a decision that's made. It's made if you go over the 50 count. 49, you're under the line. 50 and a half, you're over the line. What takes that grain of sand across the 50 line? We have to make a decision. We have to make it operationalable. We have to do that. And we do that on the basis of trying to get as much information as possible to work out where does it swing across so that the benefits and harms weigh each other in the right direction of changing the way that we give treatment. But there's nothing magical about it. It's a decision that's been drawn in a pile of sand as to what side is the high heap and what side isn't. And yeah, there's evidence behind it, but exactly where that line goes? There's uncertainties that we have to accept. We're going to have to do something about it. But it's unsure. There's an ambiguity there about where it really lies. Actually, I think there's a more fundamental one, and that's that, is there actually a line? And that's a real struggle to work with. Is this a vase? No. It's not a vase. It's faces, is it? No, it's a vase. And now it's faces. And now it's a vase, and now it's faces. And now it's faces. And is it faces or is it a vase? Is it faces or is it a vase? Which is it? But when you're looking at it, it's one or the other, isn't it? It's not both. It's one or it's the other. But it's both. But it's one or the other. Stuff's difficult. Yeah, this is an optical illusion. But sometimes stuff is just too complicated. And if you look at it one way, it's one thing, and if you look at it one way, it's another thing. And sometimes we say things one way, and sometimes somebody else will say some things another way. And they are both the same. They're different words, they're different things, but they're both true. It's a vase, and it's faces, and it's neither at the same time, but it is both at the same time. So sometimes we get what's an uncertainty in terms of feeling because it's both things. I think. Oh. Is anybody allergic to latex? No, seriously, is anybody allergic to latex? Because this could be really embarrassing if we have to actually rush you to hospital. No. Who knew where that balloon was going? Sometimes things are just volatile. You just don't know what's going to happen. Yeah, if you're a dead clever environmental scientist who's got physics and all the rest of it, you can work out the air resistance in the room, the amount of swing I put onto my hand, where it was going to go. But then you also need to be a psychologist to work out who was it that was landing near it, who had that competitive edge to get their hand to the ball. And Were they thinking, right, I'm going to knock it back to him because he knocked it out here, and I've no idea what's going on with this weird balloon that's just suddenly started floating in the middle of a room? Or am I going to knock it backwards so that someone else can play? Or, given that they've knocked it back to him and he's knocked it back, am I going to be bloody awkward? And just when it looks like he's going to catch it, I'm going to get it off the front row and knock it back again. How, some things, yeah, you sort of think you could understand how that was going to work, but actually, it's just too complicated. It's just too complicated to understand. And so, sometimes things are uncertain just because they're really, really complicated. And sometimes we pretend that they're not that complicated, so we work out where the first hit's going to go. Or we work out that, on average, in an audience like this, the balloon gets knocked back to the presenter. In the end. But sometimes things are just too complicated to know, and we're uncertain because it's complicated. And sometimes things appear really complicated, but there are dead simple, really simple underlying rules. But you still can't really tell what's going to happen. So, this is a pretty picture of dots on a graph, and this might be the point where you get your glasses out from the back, maybe, or not. But they're sort of things that are moving and living, apparently, and growing and dividing. And this is the game of life from the 1970s. It's an attempt at inventing artificial intelligence. And what it does is it says, if you have a blob that lives on its own, it will only live one generation because it can't live in isolation. If you have two blobs, then they will live. If you have three blobs, they will have another blob that grows near them, and then it goes on from that. If you have too many blobs around you, you're overcrowded and you die off in the middle. It's incredibly simple. There's about 4 rules that run it. And if you start with a random selection of dots that will or won't be there on that graph paper, and then run those rules repeatedly, you end up with things happening. And sometimes it generates things like this, purely by chance. And this arrangement of dots will just walk in that direction. It will follow those rules. But why it happened, how it works, sometimes there's incredibly simple rules that underlie things, and yet, through randomness, really complicated phenomena can emerge. And you're unsure when you first throw those dots down whether or not one of these things will or won't emerge. But the rules underlying it are really clear. And we're in that situation sometime. We know the rules underlying a lot of this stuff. The rules underlying it is we need to kill off all of the cancer cells. That's the rule that underlies it. But exactly if we can get the drugs to the right place and the zap to the right place and the surgeon with the fingers in the right place, we don't always know where the randomness is going to take us. And there's a fundamental thing that sits under a lot of this stuff about chance and understanding and volatility and uncertainty and doubt. And some of that's about, how do you see life? Is life like this? There's sort of a set of rules, and if you know the starting components of all the dots that are on this piece of paper, you will be able to work out what's going to happen. Or do you see life more like the balloon? We know roughly what's going to happen on average, but we don't know where that balloon will go in between times from that first hit out to coming back again. Is it volatile? Is it changeable? Or is it deterministic? And there ain't really a way of knowing the difference of that. That's a difference that is about your understanding of existence and your own way of looking at the world. And that, I think, plays into an understanding of doubt and uncertainty and how we live with it. I know that my way of dealing with uncertainties in medicine is I walk into work every day knowing every morning that all of the children that I'm going to look after that day are going to be the ones that get through. And I also know that that's not true. But every day I walk in, and I know that when I walk through the door. And I have to have both those things at the same time. And that's how I try to think about it, or believe it. And I try to think about my uncertainties in different groups, so I know where my uncertainties are. But uncertainties, as we face them, are an enormous range of different things, and they all come in together, and they produce the things like fear and anxiety and worry. And we professionals and lay people all know about those things, and sometimes I think we as professionals don't express that we also have great uncertainties as well in life, and how these uncertainties are and what they really mean and what they're all about. So I thought I'd take this opportunity to talk a little bit about that, and thank you very much.